Want a score over 850 in your HESI Med-Surg exam? Then let's get started. Question 1. Which of the following conditions is characterized by a deficit of sodium in the blood? Hyponatremia, hypernatremia, hypokalemia, hyperkalemia. Pause the video and select your answer. If you chose option A, you are correct. Hyponatremia. Hyponatremia refers to a lower than normal concentration of sodium in the blood, typically defined as a serum sodium level below 135. Question 2. Which of the following is a potential cause of hyperkalemia? Excessive potassium intake, diuretic therapy, Addison's disease, hypoparathyroidism. Pause the video and select your answer. If you chose option C, you are correct. Addison's disease. Addison's disease or adrenal insufficiency can lead to hyperkalemia due to decreased aldosterone secretion, which impairs potassium excretion by the kidneys. Question 3. Which of the following is a clinical manifestation of dehydration? Bradycardia, hypotension, peripheral edema, increased skin turgor. Pause the video and select your answer. If you chose option B, you are correct. Hypotension. Hypotension or low blood pressure can occur in dehydration due to decreased blood volume and inadequate tissue perfusion. Question 4. Which of the following is a potential cause of metabolic alkalosis? DKA, prolonged vomiting, hyperventilation, renal failure. Pause the video and select your answer. If you chose option B, you are correct. Prolonged vomiting. Prolonged vomiting can lead to metabolic alkalosis due to the loss of gastric acid from the stomach, resulting in an increase in serum bicarbonate levels. Question 5. Which of the following nursing interventions is appropriate for a patient with hyperkalemia? Administering potassium supplements, encouraging intake of potassium-rich foods, administering a sodium bicarbonate, administering a loop diuretic. Pause the video and select your answer. If you chose option D, you are correct. Administering a loop diuretic. Loop diuretics such as furosemide promote potassium excretion by the kidneys and can help lower serum potassium levels in patients with hyperkalemia. Question 6. Which of the following conditions is characterized by increased serum osmolality and thirst? Hyponatremia, hypernatremia, hypokalemia, hyperkalemia. Pause the video and select your answer. If you chose option B, you are correct. Hypernatremia. Hypernatremia, or elevated serum sodium levels, results in increased serum osmolality, leading to thirst as a compensatory mechanism to increase fluid intake. Question 7. Which of the following is a potential cause of hypokalemia? Excessive potassium intake, Cushing syndrome, acidosis, hyperparathyroidism. Pause the video and select your answer. If you chose options B, you are correct. Cushing syndrome. Cushing syndrome or hypocortisolism can lead to hypokalemia due to increased urinary potassium excretion caused by excess cortisol. Question 8. Which of the following is a common clinical manifestation of hyponatremia? Hyperreflexia, muscle weakness, hypotension, hyperthermia. Pause the video and select your answer. If you chose option B, you are correct. Muscle weakness. Muscle weakness is a common clinical manifestation of hyponatremia, which can occur due to alterations in neuromuscular function. Question 9. Which of the following conditions is commonly associated with metabolic acidosis? Diarrhea, excessive antacid use, hypoventilation, hyperventilation. Pause the video and select your answer. If you chose option A, you are correct. Diarrhea. Diarrhea can lead to metabolic acidosis due to the loss of bicarbonate-rich fluid from the GI tract, resulting in an imbalance of acid-base status. Question 10. Which of the following interventions is appropriate for a patient with hypovolemic hyponatremia? Administration of isotonic saline, administration of hypertonic saline, administration of loop diuretics, restriction of fluid intake. Pause the video and select your answer. If you chose option A, you are correct. Administration of isotonic saline. Hypovolemic hyponatremia occurs due to both sodium and water loss, and the primary treatment involves volume replacement with isotonic saline to restore blood volume and sodium concentration. Click that subscribe button and join us next Monday.